Hello, my name is Kristy Fluty. I am going to be talking to you about the barriers to ethical nursing practice for older adults in long-term care facilities and how ethical issues facing nurses treating older adults affect their overall care. Study design. In 2018, an article in the Journal of Clinical Nursing showed a study that was a qualitative, descriptive design using a purposive sample of registered nurses who cared for patients in long-term care facilities. The data was analyzed by qualitative content analysis. Key points of the study found. The study found 5 recurrent themes after interviewing nurses related to barriers to ethical care of older adults. There was the emotional stress caused by the death of patients and the demanding families, difficulty coping with emergency situations, and communication with older adults. Emotional stress. By facing death and the chronicity of patients they care for, long-term periods of time increase feelings of stress. The greatest emotional stress involved frequently facing death of their aging patients with do not resuscitate orders. The associated behaviors of family members of patients increased nurses' emotional stress, and the emotional stress increased when nurses felt there was nothing they could do with worsening health, such as when patients had cancer or dementia. Difficulties coping with emergencies. Participants felt they were underprepared for emergency situations that occurred in the long-term care facilities, including falls, hypoglycemia, hypotension, and cardiac arrest. Participants also noted feelings of guilt related to delayed emergency care when cardiac arrest patients died en route to the hospital. Communication with older adults. Impaired cognitive abilities and hearing difficulties increase difficulties while attempting to communicate with older adults. Results in patients' needs not being met timely, if at all, and nurses express frustration and feelings of guilt related to not being able to fully communicate with their patients. Implementation for nursing practice and personal application. This study shows that the relevance for nursing practice to decrease ethical dilemmas include providing counseling services, continuing education for geriatric populations, as well as increased training for emergency situations. Although I do not practice in a long-term healthcare facility, a large majority of patients are geriatric, and I face the same ethical issues that the nurses in this study discussed. My plan for personal application related to this study is to seek out additional continuing education related specifically to geriatric care to better prepare myself for this population.